Hello, we'll just wait for a few more people to join and then we'll get started with our live today, which is all about nerve pain. Fab. You can see a few of you have joined. So I hope you had good Mondays. Mine has been quite busy with patients and now this live, but my Monday is normally my busiest kind of clinic day of the week. So I quite like to start with that. So I hope all of your days have been good too. So today we're going to talk about nerve pain and how we can help resolve it. And I've kind of broken it up into 6 steps, which is the sort of steps that I tend to look at in clinic and when I'm trying to help people as well. Let me know if you can hear me okay too, because I have got a new phone, so I'm hoping that it works just as well as the other one. So our 6 steps. The first thing we need to do is work out, is this actually nerve pain? Because quite frequently we'll have people come and say to us, oh, I think I've got sciatica, I'm getting some pain down my leg and that kind of thing. And sometimes they're correct, and it is sciatica, but sometimes it's not, and it's actually referred pain instead. So they've actually got an issue with their back, it's referring down their leg slightly, but it's not the nerve that's referring. It's just that sometimes pain isn't always in the exact location of the issue. It can spread, it can move around a little bit. And so that's why it's really important to make sure, well, are we treating nerve pain or are we not? So to differentiate between the two, we run a battery of different tests basically. We always kind of look at your range of motion, that kind of thing. But when we're looking at nerve tests, the first thing is nerve sensitivity. So we can do a couple of tests for both the lower limb and the upper limb, because we also get neural pain in our hands and our arms as well as our legs, to see whether that brings on the nerve pain. So nerve pain, we often kind of describe as sometimes it might feel a bit fiery, it might feel pins and needlesy, sometimes you'll get a bit of numbness maybe, sometimes it can be quite sharp, but often for a patient it can be hard to differentiate between referred and nerve pain, which is why we're here. We're here to do that for you so that you don't have to work it out. So by doing our what we call a sensitivity test, sensitization test, we can work out when we stretch the nerve, is that making the pain worse, yes or no? If the answer is yes, then there's a good chance that the nerve is sensitive, therefore the nerve isn't very happy, it's probably nerve pain. If no, then that tells us that it's probably not nerve pain and it's actually probably referred pain that they're getting, and that's the route that we need to go down. We also look at other things like reflexes as well. So you might have been to the doctors and they hit your knee with the hammer. We do all of that too. We do myotones and dermatones as well. So dermatones, there are nerves that come from my brain that supply the skin on my arm or everywhere in my body. And if I've got an issue with the nerve area in my arm, it might be that I'm a bit numb here, and I might not realise until someone tests this side versus this side, and I think, oh, actually I can't feel that side as well as I can the other side. And that again would tell us it was a nerve issue. We don't always see nerve pain and issues with dermatomes, but sometimes we do. And we also look at myotome testing as well, which is the same principle, that nerves come from our brain and go down to whichever muscle they need to go to. So we need to test that muscle to check that it is firing correctly, that nerve is sending the right signal to the muscle at the right time to get it to fire, to make the muscle work basically. If that signal is interrupted at all on its way, then often it means that muscle isn't going to work as well as we would expect, and that's when we start to think, okay, maybe is this a nerve pain? A test like that by itself isn't going to tell us if it's nerve pain. It could just be that muscle's weaker, it could just be that you've got pain in that area and therefore you don't want to move. But that's why we call it a battery of tests. So we use quite a few tests that then give us an overall picture as well, because the whole time we're just trying to test the integrity of the nerves basically. And often we find with nerve pain as well, we often feel more pain distally. So that means further away. So for example, sciatic kind of nerve pain is often worse in the foot than it is higher up. For hands and arms and that kind of thing, we tend to feel nerve pain worse in the hands than we would in the shoulder, for example, even though the nerve comes down from the neck. So that's another kind of telltale sign for us as clinicians that maybe this is actually just referred pain and not nerve pain. So that's our step 1, which is differentiating referred and nerve pain. Step 2 is the why. So once having kind of diagnosed nerve pain, we need to work out, well, why has this happened? Is there an underlying weakness somewhere that has caused this? Are some muscles really overworking? Are some kind of barely working compared to before? And is there an activity maybe that we're doing that is really aggravating it? Because if we can't work out the reason why, all we're going to be doing is treating the symptoms and not treating the cause. And at On Your Game in particular, we want to be giving you long-term results that you can keep doing your activities and that kind of thing. And we're not going to be allowing you to do that if we don't get to the why. We just kind of give you the what. So that's why it's kind of so important. And we want to, if we don't, what can happen if we don't work out the why, is that you kind of get out of pain quite quickly, and you think, oh, okay, that's fine, I'm going to go off and carry on doing whatever I was doing, but the underlying cause hasn't been addressed. So if that underlying cause hasn't been addressed, often we find people coming back in a few months' time, so pain goes, a few months' time they come back with the same thing, get rid of the pain, they come back again. And that's the vicious kind of cycle and circle, whatever you want to call it, that we really want to try and stop, I suppose. And this is often why we suggest to people sort of a block program where you're going to work with us 2 times a week for the next 6 weeks, for example, because we know that more intensive physio for the first few weeks is generally going to get everything to reduce down and settle much more quickly, and we know how effective it is, and it actually saves you money in the long term and eventually improves your quality of life overall. So step 3 is we want to formulate an action plan. If we don't have any kind of plan, then what are we treating? Initially we want to be able to get someone out of pain. That's going to be our first thing most of the time, but also to increase someone's active range of movement. So if your movement is reduced either as a result of pain or stiffness or nerve pain, whatever it is, that's going to be kind of the first focus for most people, because nerve pain, if you've ever experienced it, and put a yes in the chat if you're comfortable to, if you have, you'll know how painful and debilitating it is, because often you can't get into a position where you don't feel it, or you might not feel it for a bit and then you forget about it and you do something and it suddenly hits you. So it is very horrible to experience. So to get rid of the pain initially, we'll often do a mixture of kind of hands-on therapy, and sometimes utilising specific exercises as well to help with that. And typically the exercises that I like to do are ones that the patient doesn't find painful. So if they've got a specific motion that they can work in that isn't painful, I'll give them exercises like that to start with, because otherwise, if I give them the painful stuff, they're probably not going to do it because it's going to be painful for them. It might even aggravate their pain too, and won't kind of help it settle down. With nerve pain, the other thing we really like to give are nerve glides. If you have a look on our Instagram page, you might have to scroll back a bit, or you can drop me a message after this and I'll tag you on our Instagram page on the videos that we've previously done for nerve glides. So muscles need to be stretched very similarly to, nerves need to be stretched similarly to muscles, but we do it in a slightly different way. So an example of a nerve glide for the upper body, if I was having some issues with my hand, would be, I say to people, imagine you're a waiter or a waitress and you've got your plate of food here. You're not a very good one, move it out of the way and the food goes onto the floor. I'll try and move to the side so you see a bit more. So my hand's here and out, like that. And we can add our head in as well whilst we're doing it. So you see there, I'm not holding the stretch out, I'm going out and in. So that's typically what we see with nerve glides, is we're kind of taking the nerve on and off. And that can be quite good to just help free up the neural pathway that's there and just help ease the pain that you're experiencing, that nerve pain. If the nerve pain is very severe, then something I will sometimes suggest is that people do go to their GP and get some neural drugs, amitriptyline, or something stronger if they need it, because it can, although I don't like having to prescribe medication as it were, if you're in so much pain that you can't do the exercises that I've given you, you're then going to sit down more or be more sedentary or lay down, whatever it is that the position is comfortable, and you're going to go in this circle of, I'm in pain, so I'm not going to move. You get stiff and you're getting more pain, so then you don't move. And it just goes round and round. If we can break that cycle by just getting some drugs in there to reduce the pain, then that can mean that in that time you can do a bit of rehabilitation, and then you can come off the drugs and hopefully feel a little bit better as a result, because you've been able to do exercises in the meantime. So sometimes there is a need for some neuropathic drugs in there just to kind of help with that. And we want to be sort of relaying with our exercises kind of positive feedback to the brain as well of, you know, this exercise is not painful for us, this is a safe thing to do, and all of that helps our brain think, okay, actually we can move normally, this is okay, and that can help things settle down as well, because pain isn't just a physical experience, it's an emotional experience as well. So anything we can do to get that to settle down really is a positive. And as soon as we're kind of moving out of pain, we can then start with some harder exercises. And interestingly, all of our kind of research into back pain says it doesn't matter what exercise you do, as long as you're exercising, it is going to help with back pain. But I do think some are more helpful than others from the perspective of maybe not aggravating and not causing people additional pain to what they're already experiencing. So that is our step 3. So our first one was, let's diagnose this. Is it referred? Is it neural pain? Our step 2 was, what's causing this? Our step 3 was, formulate a plan. And now our step 4 is what we do after pain has gone. So now that your pain has reduced and we have started some exercise, we now further want to address those underlying issues that have caused the pain. Because after all, we don't really want it coming back. And so we work out what the underlying issues are in your initial assessment, but sometimes what I've found before, if someone has got really bad nerve pain, I actually can't do as thorough of an assessment as I could with someone that's got slightly less pain. So what we tend to do at the clinic is reassess quite regularly. So we'll do our initial assessment, and then we'll have a working diagnosis there. And then once that pain has settled quite a bit or completely gone, we can reassess and go, okay, actually now we can see the underlying cause of this. And like I said, kind of at the start, it might be that you've got an area that is really weak, you've got an area that is really tight. It might be that you're so dominant on your right side that you do everything on there, and that's really overworked. Your left side is really underworked because it's not doing as much. And then you end up being quite weak on one side and quite strong on the other. So it's those kind of underlying things that we can then, once you've got out of pain, we can then start to work on. And that's mainly going to be through exercise, through strengthening, through stretching, whatever it is that we feel like you need. And nerve pain isn't just specific to a particular demographic. You know, it's not just sedentary people, it's not just active people. It can happen to anyone. And I have worked in rugby clubs with professional players who do have nerve pain as well. So, you know, it can kind of strike at any time, but it doesn't come out of nowhere. There is always a cause. And even if someone comes to us and says, oh, I was just bending over, putting my sock on and I sneezed and then my back went and that was it. You know, our back should be stronger than us sneezing and then having loads of pain. So that's why we want to look at the underlying cause that may have been there for quite a long time. And often pain is the last kind of manifestation, actually, like that weakness has been there, that tightness has been there, that lack of proprioception has been there for a long time, that nerve has been really fatigued. You just haven't realised until the pain's come on. Pain is what you resonate with the most because it's the most annoying thing that's there. And then step 5 is we want to be continuing to reinforce movement patterns that we have created. You know, we build strength, we build resilience and tolerance to lots of different loads and lots of different positions. It's no good me getting you super strong in the gym and you can deadlift loads and you can squat, whatever it is, but actually the movement that you need to do is getting your 18-month-old baby out of a cot and you can't do that with a perfectly straight back. It just doesn't work. So sometimes we also have to think more functionally. Okay, well your child is going to be getting heavier, we hope, because children grow and they get bigger and stronger, and therefore the weight that you're having to lift is going to be getting progressively heavier out of the cot. And I use this example of getting a child out of a cot because this is something I've seen in my career so many times, where people have either hurt their back doing it, or they notice the pain really badly when they are doing it. So we want to build lots of resilience so that you can go into kind of everyday life and not be worried about a scenario, and not have to say to your partner, oh, can you get the baby out of the cot? I can't lift that up. Or feel like you can't put your shoes on because you're scared. So we want to be building lots of resilience in lots of different positions, not just in our perfect gym positions that you see. We want to be building that up. And then number 6, so once we are super resilient to all loads that could come, we want to maintain the improvements that we have had, so that can kind of prevent relapses that we've had to, and kind of keep you performing at your best and at that level. Now's a good time, if you've got any questions, to pop them in the chat, so that you've got a few minutes to type, and then I can get back to you on them whilst we're live. But the importance of maintenance is, just because you're out of pain, just because your strength or whatever the underlying cause, is sorted, we don't want that creeping back in again, because often if we're not being reminded of the pain, we then stop doing our kind of preventative exercises as well. And if we're doing something in our everyday life that has been aggravating it, maybe like sitting at a desk, for example, that's something that's not going to change. You're probably always going to have to sit at that desk till you retire. You want to be making sure that you're doing adequate stuff to maintain and prevent before then, so that nothing creeps up on you, you don't have any surprises, and you can continue to perform at that level or higher. We don't want people coming into the clinic and then feeling like they're never going to be the same as they were before. And particularly with sort of nerve and back pain, there is no reason for that. We do have the odd patient that has come in after a really bad fracture, and they've had pins and plates and stuff put in, and sometimes we have to manage their expectations and say, yes, I don't think your ankle is going to be exactly the same as it was before. It is going to move differently, but where possible, we want to be getting people back to even better than they came in. So that maintenance stage is important, and something I tend to see a lot in clinic, and I'm sure the other guys that work with me do as well, is typically when we see people dropping off of their exercises and not being as adherent with them, they go, oh, well, I just forgot to do them because I wasn't in pain, so I kind of didn't really think about it. And I completely get it. Something's not nagging at you all the time. You're not thinking, oh, I'm in so much pain, I better go and do my exercises. But the problem is, what then happens is you get a dip in your rehab. You've had a dip in your rehab, and then you tend to have a dip in your condition that will follow that. Not straight away, but maybe a week or two later. So that's why it's important just to maintain things, just to keep things running. Fab. Thank you very much for joining me. I don't think anyone's got any questions, but if you do happen to think of any after, you can send me a message anytime. You can put a comment on here and I'll reply, or one of the other guys will reply. And if you obviously do have any nerve pain, any back pain, send us a message and we can get you booked in to have a look at it and let you know how we can help you. Thank you very much. Have a lovely evening. Bye.